Okay, let's start. So on behalf of the ILO's Impact Insurance Facility and the Joint Learning Network for Universal Health Coverage, I would like to extend a very warm welcome to all of you who have joined us today. The topic of today's webinar is Design Thinking as a Strategy for Innovation in Public Sector Health Schemes. Now, design thinking, also known as human-centered design, is a methodology that has become popular in certain sectors as a means of solving complex problems for finding user-centric solutions. Now, you might be wondering, what does this mean? And our speakers will definitely shed more light on this, but let's take an example. Here is an iconic photo of Steve Jobs. Now, design thinking is frequently used in the technology industry. Steve Jobs, he's an industrial designer, chairman, CEO, and co-founder of Apple Inc., for those of you who don't know. In this picture, he's proudly holding their invention, the iPhone. Now, it wouldn't have been possible to develop the iPhone without taking a human-centered approach into account. And only released in 2007, the iPhone has been quite revolutionary culturally and otherwise. Design thinking, however, is from our account a relatively new problem-solving approach for public sector health schemes. We are therefore very excited to share recent experience of how design thinking has been effectively used by the National Health Insurance Scheme of Ghana. And it's our intention that this webinar inspires listeners to think about how this methodology can be applied broadly to other problems within the health context and beyond. So, just a few words about the webinar system. You can hide the control panel by clicking on the orange arrow as indicated. We've allocated time for questions at the end of the session, but you can type your questions into the box as indicated throughout the webinar. For those of you unfamiliar with the ILO's Impact Insurance Facility, we are a unit supporting the private sector, governments, and their partners to realize the potential of risk pooling mechanisms such as insurance and other coverage plans. And this is achieved through a strategy of stimulating innovation and unlocking capacity. Our work is guided by three principles, namely that solutions are people-centered, secondly, that they are driven both by evidence and experience-based learning, and thirdly, that collaboration between stakeholders is necessary to deliver results. It's also worth a mention that our project with the NHIA of Ghana is made possible with the general support of the Agence Française de Développement. For those of you who are unfamiliar with the Joint Learning Network for Universal Health Coverage, the JLN is an innovative community of practitioners and policymakers from around the world who are actively engaged in exchanging tacit knowledge on challenges faced and co-developing practical solutions to implement universal healthcare reforms. The resulting tools, which harness the joint expertise and experience of those in the network, are being used to equip countries with the practical know-how for designing and implementing efficient, equitable, and sustainable healthcare systems. At the same time, this activity also contributes to the global knowledge resources for achieving UHC. More information on the JLN tools can be found on the website. So as can be seen, the mission of the Impact Insurance Facility and the approach taken by the JLN are well aligned. I would also like to point out that Ghana is a founding member country of the JLN. So today's webinar will start with an introduction to the NHIS, why design thinking is useful, the design thinking sprint at the NHIA, and we'll end with a section on innovation outcomes and the benefits of design thinking. We have a fantastic panel of speakers today, including experts on design thinking, and I will introduce each one in turn. It gives me great pleasure to introduce our first and esteemed speaker, Dr. Lydia Selby, a medical doctor by profession with a specialty in ENT. Dr. Selby worked as a medical officer at Korle-Bu Teaching Hospital, Achimota Hospital, and in the UK prior to taking the appointment at the NHIA. She is currently Deputy Chief Executive Operations. She has 10 years experience with the organization, including 4 years each as Director, Clinical Audit, and Director Claims Management. Dr. Selby has played an integral role in several key innovations at the NHIA, such as the development of the DRG payment mechanism, and accreditation process. Dr. Selby also introduced clinical audits and e-claims with business rules for cost containment. She has attended the World Bank flagship course on health financing, WHO annual course on health financing, and the South Korean Health Insurance Review and Assessment course. Dr. Selby has been a speaker at several international conferences on health insurance fraud and abuse and strategic purchasing. So it is with great pleasure that I hand over to Dr. Selby, who will introduce the NHIS of Ghana.
Thank you, Lisa, and thank you to all who have joined us. Ghana's National Health Insurance Scheme, the law was passed in 2003 and we started implementing in 2004. It's quite a comprehensive healthcare scheme available to all citizens and legal residents of Ghana. And the innovation around this is that the bulk of the funding comes from a special earmarked levy on value-added tax on all goods and services in the country. Now, when we started, we rapidly attained membership coverage of about 11% and have gradually increased to about 42% where we have plateaued. We have 165 district offices distributed around the country that does the registrations and renewals. With about 3,000 branch staff, and even working flat out, it's a biometric registration, and the system is such that we really cannot do more than the 11 million active members we have. We have over 4,000 service providers. So the question is, how do we leverage on technology to improve or change the renewal process such that we can improve our coverage without losing the value we get from having a biometric registration? Thanks, Lisa. Can you change? Yeah. So the project decided to look at it in 3 ways. We obviously want to achieve UHC, so we have to expand the population coverage. So we needed to find a way to allow our members to renew without getting bogged up at our district offices. We have people queuing up trying to renew their membership, which is not a desirable experience for our members. The second thing was to reduce the operational burden and costs. It is expensive to keep printing validity dates on the back of cards, and with the modern day technology, there should be another way around it. And lastly, we need to do authentication at the provider sites. If we're not stamping the validity dates on the back of the cards, the providers need to be assured that the members they are providing services to are paid up members of the scheme, and therefore the claims will not be rejected. And so this project was to look at a way to, one, reduce our cost, increase our membership by using an innovative solution, incorporating the modern technology tools that are available. And at this point, I'll hand over to the ILO project team to tell you how they went about getting us to where we are now. Thanks.
Great. Thank you very much, Dr. Selby. So our next speaker is Shilpi Nanda, and we're very lucky to have Shilpi as an ILO fellow. Shilpi is leading the ILO Innovation Project in partnership with the NHIA in Ghana. Her project explores the application of digital member renewal and identity authentication solutions in the field of social healthcare, as indicated by the last few slides. Shilpi holds an MBA and is a qualified actuary with more than 10 years experience in the insurance sector. She has worked in a wide range of functions, including product development, pricing, financial reporting, risk management, and economic capital. Shilpi has worked across a number of industry sectors, including direct life insurance, insurance consulting, reinsurance, and recently microinsurance. So I will now hand over to Shilpi, who will be answering the question, why design thinking?
Thanks, Lisa. As Dr. Selby mentioned, the goal of the project was to build a better renewal process at NHIA. It's a process that's efficient for the organization, but also delivers a good user experience for our members. At ILO, a standard approach to a problem of this nature is to always start with user research, followed by a pilot that's based on the outcomes from this research. But at NHIA, at the start of the project, we decided to do things a little bit differently. One reason for doing this is because NHIA already had access to a wealth of research that investigated barriers to renewal. The research was insightful, but it stopped short of actually suggesting a solution to resolve these barriers. The second reason was, in the project, we were quite constrained with both time and money. For instance, we didn't have the luxury of spending 3 or 6 months working on a pilot solution, spending resources, only to realize after launch that it is not compatible or not acceptable by certain segments of our membership. So we were looking for a framework that built on existing knowledge, but also found new ways of collecting user insights and ended with very tangible, very specific solutions that users could interact with and give feedback on. So design thinking was the right framework to use, which we have employed to great effect. We were also fortunate at NHIA that we have a cross-functional project team made up of domain experts from a wide range of functions. So there's representation from operations, from IT, finance, actuarial, research, and this is the perfect ingredient for design thinking. Additionally, we were fortunate that in Ghana, there's a thriving local design thinking community that we could tap on. And we requested to design thinking practitioners to come on board and to help us through the initial part of the design process. So the next segment of the presentation, I will hand over to our team of experts who will take us through the design sprint that they put together for NHIA.
Great, thank you, Shilpi. So just to give some introductions, our next two speakers are both design thinking experts and will tell us more about the design thinking process and also the sprint at the NHIA. So firstly, I would like to introduce Ashlee Tuttleman. Ashlee consults to African startup and growth stage businesses, development institutions, and government entities on a variety of projects relating to value chains, agriculture, fintech, and human-centered design. Before starting a consulting practice, Ashlee created a number of successful brands and profitable agribusinesses in East Africa. And this was achieved by working directly with a large group of stakeholders, such as smallholder farmers, value chain partners, governments, and other institutions. Ashlee has also applied human-centered design practices to support the launch of 3 rural micro-enterprises and the creation of farmer rewards program with 4,000 women coffee farmers. Ashlee moved into agriculture, value chains, and human-centered design on completion of her master's in international development. And prior to this, Ashlee worked for 8 years in the private sector in the United States. So I'd also like to introduce our second design thinking expert, David Hutchful. David is an entrepreneur, design thinker, and software developer. He is passionate about designing and building technology solutions that are informed by a nuanced understanding of the social, economic, and cultural context of problems. David has more than 15 years of experience in design and software development and created award-winning innovative platforms that bring about social and economic change in the areas of finance, agriculture, and health. An example of this is Engage Spark, which is an easy-to-use web-based messaging service that extends the reach and impact of social change programs to the poor through mobile phones. Engage Spark won the GSMA's 2015 Mobile Award for Best Use of Mobile in Emergency or Humanitarian Situations after helping deliver a financial literacy program to the survivors of Super Typhoon Haiyan. David is currently a co-founder, or at least he's co-founding a startup called Bloom Impact, which will democratize access to finance for small to medium-sized enterprises. Previously, David served as the Director of Technology Innovation at the Grameen Foundation and was a member of the Technology for Emerging Markets group at Microsoft Research. David has a degree in Computer Science and Philosophy from Kelvin College and a master's degree in Information with a specialization in human-computer interaction from the University of Michigan. So with that, I'm sure you're very eager to hear from the experts, and I will now hand over the control of the screen to Ashlee.
Thank you so much, Lisa, for that kind introduction, and for all of my co-presenters and everyone here. I'm sure you're wondering now, after all this talk, what is design thinking? Well, let me give you a high-level overview. Design thinking, or human-centered design, is a highly iterative process that starts with developing empathy for the user and ends with field-tested solutions. The process emphasizes early testing of minimal viable products to encourage fast and early failure with minimal sunk costs, as well as continuous rapid feedback loops from users to build on what is intuitive to and effective for users. Design thinking requires organizations to bring together a diverse, dedicated team to problem solve together, as Shilpi indicated. The design thinking process can and has been used to develop products, services, programs, and policies by both the private and public sectors. When organizations truly embrace the process, we find that it can have long-lasting effects on how teams work together, how they see their beneficiaries, customers, and even colleagues, as well as how they innovate. More concretely, let's take a look at the circle in the slide, which takes you through the 3 major stages of design thinking. We start with understanding, which is diving beyond knowledge in order to understand and empathize with user realities. This helps teams shed what we would call their expert knowledge in order to define the actual problem that they want to tackle, which might be slightly different than what they might have expected. The next stage is exploration, which essentially is hyper-creative and open brainstorming, seeking inspiration from other areas, and the start of solutions, which we'll further discuss as prototypes. Prototypes are built quickly and easily at a low cost, providing just enough to test directly with users. The third stage is materialize, which includes user tests and iterations, or in other words, improvements and changes to the first prototype. This helps the design team to validate their solution and improve it based on user feedback. So as the image infers, this is a continuous process that at times seems messy and chaotic, but if done well, will make complete sense at the end. Oftentimes, this process takes months to fully work through. Now, design thinking in practice can play out as a 6 to 9 month long process, or it can be shortened to deliver quick results. In the case of NHIA, Shilpi challenged David and I to work together through the process and support the team to deliver a prototype in roughly 5 days, which is rather short. Using our expertise applying design thinking with companies and organizations, we tailored the 5-day Google Sprint methodology for NHIA. Here we have a link to the book that details the do-it-yourself Google Sprint methodology, which we don't quite have time to cover today. In the coming slides, we'll give you a high-level day-to-day walkthrough of the design thinking sprint. We'll focus on daily outcomes, but each slide provides a short list of the methods we used, although we won't have much time during this presentation to delve deeply into the details. We can see that days 1 and 2 are devoted to understanding, which I'll cover with you. Days 3 and 4 focus on exploring, and days 5 and 6, and really thereafter, materialize insights from the previous days, which David will walk you through. Thereafter, Shilpi will explain how she and the design team continued the cycle after our workshop. So, day 1. Our goal was to get the cross-functional design team to expose their assumptions and expectations for what the result of this project would lead to. They knew the project goal was to digitize the renewal process, and that they were signed up to use something called design thinking to come up with a prototype. So we needed to know, what did that mean to them? And what biases and assumptions was the team bringing with them to this project? Throughout the day, we learned the NHIA team was accustomed to using internal categories to explain user identities, from rural to pregnant to indigent. These categories were based on institutional research and membership categories. This gave us insight into what knowledge the team had about its members, which we'll also refer to as users in this presentation. In relation to the solution, some team members expressed their expectation that we would create a smartphone app in-house. So they already thought they knew what we would end with. Others couldn't conceive of how you could test a process prototype, which seemed more abstract than a product or service. Day one ultimately helped us uncover some of the biases the team had, which influenced what they thought they knew about their users. These assumptions about inherent knowledge found in every organization and company have a definitive impact on new projects, programs, products, and services. So it was very important for us to bring them out in the open on day one. It also helped us build the foundation for exploring over the next 2 days the difference between knowledge and understanding. On day two, our goal was to get right out into the field. So we brought the design team to engage with users as early as possible, as you can see, to start exploring who users are, what their challenges and desires are in life, and how multiple dimensions of their lives may influence their relationship to healthcare. You'll notice this is a much broader understanding of who users are than a one-dimensional category like rural or pregnant. During the day, the design team split up and had conversations with users in urban and peri-urban environments. While we prepared some questions in advance, these were not formal surveys, but rather conversations. Our IT professional on the design team transformed throughout the day. He started with a questionnaire that was rather dry, direct, and it was focused on NHIS membership. But by the end of the day, the same team member was having conversations and exploring people's lives in relation to their family, finances, and so on. He very clearly showed evidence of growing user empathy and heightened comfort with engaging with users. So at the end of this day, we found evidence of the team moving from knowledge to understanding, in part validating reports of what they had read, but also seeing users as people rather than categories on paper. This more holistic, personalized, empathetic thinking would be crucial for the days to come. So I'll lead you to my colleague David, who will start with day three.
Thank you, Ashlee. The activities for the rest of the days were focused on the explore segment of the design thinking circle Ashlee showed earlier. We worked with the team to better define the problem, identify the target user, ideate, prototype, and test the solutions they developed. Day three was a busy day. We had two main goals. First was to synthesize the findings from the previous day's field studies to identify key insights, target users, and to reframe the problem in terms of the user's need. The second was to ideate solutions that address the identified user need. The day began with the design team systematically reading their field notes out to their colleagues, who in turn wrote down quotes or points of interest on post-it notes. By sorting and grouping these notes and then labeling the resultant group of notes to create what we called affinity maps, the design teams were able to uncover the key themes and insights from their research. Importantly and fortunately, these findings, based on 1 day of field study, aligned well with the data from previous research. This created confidence in the process and, importantly, allowed the team to internalize and develop an empathetic understanding of the problems in a manner not possible if one were just to read the findings of a research report. For example, a member of the team from the finance department seized on an emerging theme of the challenges faced by the NHIA staff at renewal centers, and throughout the sessions pushed hard to make staff welfare, or as he called it, happy staff, happy customers, one of the central problems the team would seek solutions for. He became the custodian and advocate for solving this problem. He had an empathetic understanding of that issue. Now that the key issues were understood, we needed to prioritize which ones to address. The synthesized data allowed the users to create multiple user personas. These are short story-like profiles of the main issues constructed from the data collected. They capture the user's challenges, needs, persona, aspirations, and capabilities, including how the user experiences one or more of the identified problems and how that affects that particular user. These personas were given names and pictures, effectively personifying the different problems and opportunities that had emerged from the field study. The design team then spent time bonding with each one, after which they took a vote on which personas and thus which problems they found most compelling and would like to address in the design sprints. It is important to note that the personas or issues that were not chosen, for example, the staff welfare one, are now jumping off points for future design sprints, and were also useful for estimating the response and impact of design decisions on certain user types as the solutions for this design sprint were developed. From the morning session of that day, the design team identified 2 key problems that affected renewals for their selected persona, who they had named Adwa Baby. Adwa, the target user, finds the current process of member renewal cumbersome and time-consuming. She also did not have a clear understanding of the services NHIS is offering. From the field study, we learned that not only is her time important, but that NHIS is important to her because it ensures the health of her children, her prized possessions, which it guarantees. To get the design team from jumping to preconceived solutions, the team went through various activities that pushed them to seek inspiration from domains outside their field of expertise. Some of them looked at communication companies like telecom companies, or communication campaigns by telecom companies, and others looked at how utility companies billed and took payments from their clients. Instead of a traditional brainstorming session, each person worked on their own, using sketches and storyboards to illustrate and iterate on their solutions. They constantly had to revert back to the user persona to ensure that their solutions were relevant to the use and usable by that user. At the end of the day, we had a mini gallery show where each user displayed their solutions and explained it to fellow team members. Afterwards, each member voted for their features of other solutions they liked and an overall solution concept. The winning features and concepts were then combined into a coherent solution. The professional diversity of the team also ensured that the solution was feasible from an operational, financial, and technology perspective. The design team elected one person to be a decision maker. In our case, it was the project owner, but in other cases, it could be the CEO or whoever needs to make sure the project gets delivered. This person was responsible for breaking vote ties and having a final word. This facilitated decision making and keeping the team focused on the same direction. Day 3 ultimately helped us from user insights to a user-generated solution. The design activities pushed the team to converge on a particular set of user-driven problems, not the problems they thought needed solving, to explore broadly potential solutions, not the solutions that they had in mind beforehand, and then to creatively converge on a solution inspired by both the user's need and the real meaning the solution would have for that user. No longer were we trying to make the renewal process fast for Adwa. We wanted to make sure that Adwa could ensure her children had access to the healthcare they needed. So day 4, the design team then moved into creating prototypes of the winning solution ideas. The goal was to create just close enough to the real thing experiences for the users so they could elicit useful feedback on whether the solutions would work. The team used commonly available tools to create sample user interfaces that the users could interact with. We employed a strategy from the Google Sprint process where each team member had a particular task. Content creator was responsible for pulling together all the text that was needed and the language, and the stitcher was the person responsible for putting everything together so that there was a coherent prototype. We also created test scripts that would guide the testing process. The goal of this was to make sure that, as in all good interviews, the user could express their thoughts and actions with little lead-in from the interviewer. By the end of the day, we had 2 prototypes and testing guides which we could take to the field. On day 5, we went out to the field to test the prototypes we had created. Our goal was to get as much useful feedback from a diverse group of users as possible on the prototypes. The team split up and visited different NHIA renewal sites to find willing participants. The design team took turns running users through the various prototypes, while other members took notes, observing both verbal and non-verbal cues. For the prototype on the phone, we also recorded user interactions, which allowed us to review later where they hesitated or got stuck. Generally, users responded positively to the prototypes. Creating certain assumptions such as familiarity with USSD menus, willingness to pay with mobile money, and digital literacy were validated. while difficulties with terminology and the flow of the prototype in the renewal process were also captured. Additionally, we were able to capture the reactions of secondary users like the NHIA staff to the solutions. Another important takeaway was the design team deepening their empathy by learning firsthand how users fared with the prototypes. Placing the prototypes in a context of use allowed the team to quickly identify shortcomings and determine possible fixes. The goal of the last day was to process the feedback from the field and to use the learnings to improve the prototypes. It was very similar to the third day. We took the field notes and noted particular user challenges for which we discussed possible solutions. This was the end for the workshop. The design team was now equipped to innovate in a timely and cost-effective manner. That is, they could quickly identify and empathize with problems, redefine the problems from a user's perspective, ideate, create, and test prototypes. I will now hand over to Shilpi, who will share more on the outcomes from an NHIA perspective.
Thanks, David. Last segment of the presentation, I will just talk about some of the outcomes and how we have kept this design process ongoing after the sprint. And I'll end with some learnings or certain factors that organizations can employ to ensure the longevity of such design processes. So the 6-day sprint, which David and Ashlee just explained, it was only the start of the design process. What it helped us is to gauge an initial feel of what is desirable from a user experience. Subsequently, we have tested these prototypes in diverse locations and amongst diverse user groups. These iterations have helped us refine our offering, but also it has helped us identify groups of members who will not accept the offering or who reject it for one reason or the other. And for a national scheme like NHIS, this learning is also just as critical as the former. For instance, we found that healthy young males, although they accept technology, they question the point of health insurance in the first place. So just putting a mobile or digital application in their hands that helps them renew their policy is not necessarily going to translate into a renewal for NHIS. So this kind of an insight gives us clear actions from a communication standpoint. But from a design standpoint, it allowed the team to design some airtime benefits for group renewals. So for example, it is the hope that when the wife is renewing for herself and her children, she may get incentivized by airtime rewards to then sign up the husband or other young males in the family. The design process is not purely about understanding what the user wants, but equally about ensuring that the solution is aligned to the organizational objectives and that it can be brought to life in a technically simple manner and it is economically possible for the organization to do. So at the end of the sprint, the team has worked through the feasibility and the viability aspects of the design to ensure that whatever prototypes that we are developing or we are iterating is a feasible prototype. It's possible to iterate forever, but we drew a line at one point where we reached what we think is the minimum viable product. The minimum viable product was in 3 parts. One is the renewal prototype. The renewal prototype is a USSD-based application. It can be executed over a very simple, inexpensive feature phone. The premium payments are collected by mobile money. But in addition to that, the USSD menu has education and awareness components because users reported that they had lack of clarity around what benefit conditions are covered by NHIS or what medicines are offered by NHIS. There's also an option to do error reporting using the menu. And lastly, as I spoke earlier, it has airtime incentives for group renewals in the hope that people could sign up larger numbers of their family or perhaps even their neighbors, and this helps address some of the adverse selection in the scheme. A second compatible outcome from the process is the development of an authentication prototype. This links back to what Dr. Selby mentioned earlier in the presentation. NHIS is a national scheme. It pays a vast majority of hospital claims in the country. Therefore, it's extremely essential to ensure the right claims are paid and the wrong claims are not. The authentication prototype essentially helps NHIS to first validate that the the identity of the person on a biometric basis, and second, also validate that the policy has been renewed. This validation is done at a very low cost compared to what is done at present, which allows NHIS to scale the authentication solution across a vast network of providers. And lastly, and most importantly, we developed the communication prototype. The communication prototype actually anchors everything else. Without communication and without addressing the real doubts and addressing the attitudinal barriers in people's minds about the point of insurance, about the role of traditional medicine, about generic medicines and how they compare to branded medicines, without addressing these attitudinal barriers, none of the other prototypes will ever be as successful as we would like them to be. So these are the 3 concrete outcomes which we are now taking forward as a proof of concept. A proof of concept is just a working prototype that we wish to develop and launch in a small area to further then gather feedback from the field. I'd like to just talk about some benefits from using design thinking. The first thing, which has been a little bit of an unexpected benefit as well, is how useful the prototypes have been in getting senior management buy-in. The prototypes allow a user to easily interact with the system. So for instance, when we went to the board for approval, instead of me putting up a presentation or showing them process maps, I could request all members of the board to just dial a shortcode and experience the prototype for themselves. This enables them to empathize better with what the team has come up with. It enables them to give feedback, to give critique, and helps in the buy-in process. The second is about the flexibility in the design thinking framework that allows the reframing of the problem, which both Ashlee and David have touched upon. Reframing the problem has allowed the team to think about the project objectives in a more holistic manner. We went into the design thinking exercise thinking we will develop a renewal process, but we've developed a renewal process, a compatible authentication solution, a communication prototype, and we've come away with renewed empathy and understanding about the role of staff in the launch and the rollout of this prototype. The third thing is about change management. The design thinking process puts the user front and center of the design process, and in doing so always anchors the project team back to the person that they're developing for. For instance, even after the sprint, in project team meetings, if we were ever thinking about tweaks to the prototype, we would try and ask ourselves, does it still work for Joe Baby? The fourth thing was about the savings in money and time, which was one of the reasons why we chose design thinking in the first place. The sprint exercise was executed in 6 days, but subsequent iterations have only taken a day each. I wanted to just highlight the example of the communication prototype, which had already been recorded in 2 languages. But at one point in the testing process, we wanted to go to a particularly rural location where the residents speak a different language, Ga. And just within a day or 2, the team got together, mobilized Ga speakers within the staff, recorded the prototype in a new language, enlisted the help of Ga speakers, and we went out and tested the prototype. So obviously, from a project outcome perspective, this allowed us to test the prototype in more diverse locations. But even from a change management perspective, it was very encouraging to see the enthusiasm in the project team and the efforts that they have taken to put together a prototype just because they see the value in testing it in diverse locations. The fifth thing is about the reduction of rejection risk. Now, rejection risk is something that probably cannot be eliminated. But by iteratively testing prototypes with diverse locations, diverse groups of users, it certainly helps minimize the risk of rejection and also helps understand the users who are expected to reject it. This is very important for public sector schemes, which are always subject to a lot of scrutiny. And the reputational risk associated with any initiative that a public sector scheme does is very high. So this iterative prototype testing reduces that reputational risk and maximizes the chances of success for the final solution. And lastly, the design thinking exercise has allowed us to leverage the diverse nature of a project team, but also allowed us to engage people from outside the industry. For instance, Ashlee comes from a distribution background in agriculture, and David comes from a technology background in wider social finance. And in addition to that, we've used these prototypes to engage other government agencies, peers in the industry, and all of this has fed back and has enriched the design process. So we're glad that the framework has allowed for this to happen. Lastly, I'd like to just talk about some learnings, or rather some factors that would help ensure the longer-term success of such a design exercise. Now, design thinking, like any change management initiative, is pointless if it's done as a one-off exercise and it's not continued or doesn't live beyond its beyond the first phase. So I've already talked about the importance of continuous iteration, but it's also important to identify a clear owner or a set of group people who would own this kind of technique or this kind of process within the organization and champion its cause beyond just the sprint. Design thinking should not also be construed as a silver bullet or a shortcut or some kind of cure for all ills. That would be a disservice to what is actually a much larger process. Design thinking helps accelerate certain aspects of the project. It helps generate user empathy. It reduces the risk of failure, but it also allows to fail fast and often early, because then that leads to a lot of learnings for the organization. So design thinking is not a shortcut, but it can be a very critical part of a broader design process, and it has to be anchored back to the broader organizational context and everything else that the organization is doing in order to make sure that whatever the team is developing is fully aligned with the objectives. And lastly, one of our learnings has been that innovation is very difficult to do part-time. For instance, it is difficult to expect a person to, say, innovate and ideate for 3 hours in the morning and then go back in the afternoon to their BAU jobs. So in the sprint, it allowed us to take our project team away from their desks, and we immersed ourselves in the lives of the users consecutively for 6 days, and that has really helped us expand our own horizons. But equally, I think it's important that all the innovation is not ring-fenced to a small group of users, and that the organization takes steps to make this a broader part of the organizational DNA, that these techniques are used just beyond one project team, and that wider organization also accepts it. So with this, we end our segment of the presentation.
Great, thank you very much, Shilpi, and all of our speakers. I found that really interesting, and I hope all of our listeners did too. The process of taking such a complex problem and trying to make sense out of it all. So at this point, I would like to ask all of the speakers just to unmute themselves. We now have a Q&A session. So listeners, please, if you can send in any questions that you have, now is a good time. I will start with a couple of questions that have come in. So this is a question from Prerna Saha to Dr. Selby, who's asking about the renewal process, and she would like to know how frequent is renewal?
Thank you for asking. With us, our renewal is annually, so it's just once a year. But yeah.
Is it possible to renew more frequently than annually?
At the moment, the premium is a token, so doing it frequently becomes very small amounts of money. We're talking $5, $6, $7, $8 a year, the equivalent of that. So to break it down to like $1 a month becomes administratively not cost effective to collect the money.
Right, and I think it might also be worth pointing out at the moment that people can only renew in person at a district office, which is part of the reason why our project is around automating this and making it easier for people. Great. So the second question is for David. This is a question from Michal Matul, and he would like to know what is the right balance between cost and buy-in/ideas, i.e. how many people from the provider need to participate at each stage?
All right, thank you for the question. Ideally, right from the beginning, as many of the providers or representatives of the providers you can get involved would be great. As Shilpi noted, initially, our target was to look at the renewal process primarily from the member side, but it became very obvious, and one of the ideas that we didn't follow on was that the providers were critical to the whole. We're going to be critical to the whole process. And so in the end, actually, one of the iterations they did were around the provider side of the equation, where they also developed some solutions which they tested with the providers.
And just to give us numbers, we've tested the renewal solution with nearly 50 users, and the provider authentication has been done between 5 to 10 users so far.
Great, thank you, Shilpi. Okay, so our next question, this again is for Dr. Selby. It's a question from Richard Osei Agaiman. Apologies if I have not pronounced that correctly. So Dr. Selby, who are the regulators of health insurance in Ghana? If it is the NHIS, would there be any bias towards other service providers, since NHIS would be playing a dual role as regulator and a service provider?
Currently, the National Health Insurance Scheme does not have a competitor, and we are supervised or regulated, I guess, by the ministry. But we act as the regulator for the private health insurance schemes. They are not our competitors. If you understand the setup in Ghana, the private health insurance schemes are not really competitors of the national scheme. But it is the question that has come up for debate in several circles. So we have to see where that goes eventually.
Okay, great. Thank you. So next question. So I guess this is to Shilpi. Question from Samuel Benya. My question is, how is payment going to be made?
In our prototype, the payment will be made through mobile money. Members could use their own mobile money accounts, or equally, they could leverage on mobile money agents in their communities to make the payment.
Okay. Next question from Moses Adiambo. Is cover renewed on an annual basis? The answer is yes, I can answer. Next question, Sandisiwe Nklubi. Did the team take a broader digital financial service, money, mobile, M-insurance into consideration? So yeah, anyone can answer that.
Yeah, yes, we did. So during the sort of solution generation stage, one of the things we encouraged the team to do was to look outside to see how the problems they had identified were being solved. And the telecom industry was a clear role model or example. And that included the different financial services that they provide through their platform. So mobile network, mobile money, you know, both the service and then the agent networks that they provided, which Shilpi spoke to just now. But in general, the idea was to also look at, okay, what other kind of payment points can people have? So we were looking at banks being outlets for where people could go pay for the services. So looking at the whole ecosystem of digital financial services and trying to see how that can be leveraged to simplify the process of renewal.
Great. Next question is for Shilpi. How can design thinking be imprinted or overlaid on an overall product development process? There are similarities in terms of processes. Is that question clear?
Yes. So I think in the product development process, obviously in the design of the product itself, there is a clear manner in which the design thinking framework can be applied. For instance, if in insurance products, I mean, often we struggle in insurance industry to match the benefits to exactly what the user wants. The design thinking framework can be, just as we use to develop a process, it can be used to develop what kind of product solutions people are looking for to address whatever financial risks or healthcare risks or whatever risks that they're facing on a day-to-day basis. So a framework like the sprint can be applied, or even a broader framework can be applied. But I would also like to talk about recently in another of our projects, we used it even to judge the acceptance of people for certain price points. So this is after the product development process is done, the product is designed, and then it gets priced. And obviously the success of the product ultimately depends on whether the price is at a level that people are willing to pay. And in that situation, we used a card sort methodology, which is part of the design thinking framework. It basically makes certain combinations of products with some sample premiums, and we ask people to rank them in the order of preference, whilst also talking through what they think is value and what they're willing to pay for it. And this allows to uncover whether, what is the right price point, especially when you're doing a completely new product where you do not have any competitive data to go on. This kind of technique can help even determine price ranges that people are going to accept. So these are the two ways that I think design thinking can be leveraged in the product development framework.
Great, thanks, Shilpi. The questions are flowing, which is excellent. So next question from Kamalia Binti Mohammed No. Will non-tech prototype, ICT, be as speedily designed, e.g., those solutions which need training or HR or needs business process re-engineering? Who would like to answer?
Yeah, would you mind repeating the question, Lisa?
Okay. So will non-tech prototype, ICT, be as speedily designed, e.g. those solutions which need training of HR or needs business process re-engineering?
Absolutely. If you go back to, this is Ashlee speaking, if you go back to the framework when we first introduced what design thinking is, that is actually the framework to use if you want to build products, services, policies, as in government policies, all across the board. So it does not need to be tech specific. As we also discussed, there was a communication framework that was built based on building user empathy. The original idea for the NHIS project was to build a digital renewal system, and yet through engaging with users, a major outcome was to find that people didn't understand why. They didn't know what motivation should drive them to actually renew, rather than it being a process problem. So that's a completely different solution than what we originally thought we would be tackling, which is similar when you approach building prototypes and understanding users for a wide range of business and public sector and policy challenges.
Great, thanks, Ashlee. The next question is for Ashlee and David from Jobin Abraham. So during the sprint, how do you make sure you select the right tools and approaches during each stage of the design process?
Yeah, I would say we plan a lot. We had several discussions with Shilpi in advance. We reviewed all of the data that and all the research that was available in relation to membership and renewals, sometimes tangentially related. David and I both reviewed the Google Sprint book to keep ourselves anchored in this very short period of time, because both of us prefer, we typically practice over months within organizations as consultants or when we're building our own projects and programs. So it was quite challenging. It also required a significant amount of flexibility day to day. So we saw what was working, what wasn't working that day or for the next days, and we continuously revised our plan based on what the experience was, because for us, the workshop participants or the design team were our users. So we had to be responsive to what was working for them. David, do you have anything to add?
I'll say the only thing to add is, especially doing this for the first time can be very difficult, and I think this is one of the recommendations we'll get to, but always try and start with an expert, because they will know both the tools and also the processes that would be appropriate for the challenge at hand. So at least the first time, starting with an expert really helps to get the team oriented and to learn. That's what we did. I mean, all the other subsequent solutions that were designed by the team in-house were done without our help. But I think that first kind of phase of it, Ashlee and I, being just from our past experience, being able to bring that to bear to how to run the different, basically the different days, really helped. But again, we have to be very flexible depending on how the design team were responding to the process.
If I may add one more thing, it's also a for a sprint especially, it is a very high energy, kind of chaotic process. So David and I were very happy that Shilpi approached us to have two, so that we weren't doing it alone. So even for professionals who have done this before, we had a team that fluctuated, I think, between 6 and 11 or 6 and 12. So there's a lot going on in the room, and especially during breakout sessions, it can be a lot to keep track of as a facilitator.
Great, thank you both. So it sounds like lots of preparation and having some tools and being flexible is key to making a success of this. So I'm afraid this is going to have to be the last question, but please don't worry, we're going to get back to you over email with any unanswered questions. The last question is for Dr. Selby from Roswell Thomas, and the question is, interested to hear what were Dr. Selby's or NHIA's concerns going into the sprint methodology. Had the NHIA experimented with this methodology before, or is this a new approach? And if you could do it again, what would you do differently?
We haven't done it before. It was a new approach. I must say I left it to Shilpi and the project team to decide how they were going to go about it, and kind of took a back step and only got involved if there was a major decision to be made. And I think they will, if I'm being honest, I'm going to say I was extremely pleasantly surprised at the speed with which we got the ideas going. Yes, I would do it again. Obviously, depending on the context. I think I have been very pleasantly surprised at the results and the impact and the enthusiasm of my team. If I were to do something differently, I think maybe the steering committee that was supposed to be guiding things probably wasn't as active as it should have been. And therefore, I had to take a lot more decisions than I expected to, which slowed down the process. I suspect they would have worked a lot faster if I had been more available to take some of the decisions. So, but other than that, I have been extremely happy, and I'm hoping to see very good things come out of this project. Wonderful.
Thank you very much. And thank you to all of our presenters for answering those questions. So in conclusion, we hope that design thinking may promise to be a new technique for solving a plethora of problems related to building products, services, programs, new operations, and even policies that could perhaps change the world. I end with this quote from Steve Jobs. So at this point, I would just like to thank you very much for your time. Hope that you found the webinar interesting and useful, and we look forward to your feedback. This webinar excuse me, has been recorded and will be posted online, so please feel free to share it. For more information, please also visit the ILO facility and JLN websites. I will now be closing the webinar, so thank you again and have a good day or evening wherever you are.